The Lewisham community services are very complex. There's a lot of variety and diversity of the workload. Also, they are truly community services. They work across multiple locations. They work in schools, they work in community centres, they work in health centres, they work in people's homes, they work in GPs' practices. Because of the nature of London and the fact we were in an urban environment, there was also an opportunity where most of our care providers can actually use other providers' buildings, so because we basically were on top of each other. So there's definitely an opportunity around the buildings and the utilisation of buildings.
A lot of our estate is Victorian. It's designed for very different purposes than for what we currently use it for. We have an opportunity with the use of technology to co-locate different groups of professional staff, bring different teams together, use the estate differently and more imaginatively, allow people to work really, really flexibly, and that's a really exciting opportunity for us.
So for us, getting the devices was more than just being able to access our desktops remotely. We saw it as a great opportunity to explore different ways of working and to be able to embrace teletherapy. And so, for example, we have a therapist who's based here at Kaleidoscope, and she's able, through the medium of us having our devices and all the software that goes with it, to deliver therapy to a school that's 5 miles away.
Citrix has been about delivering apps and data down very thin links. All clinical staff can get to their apps and data from any device. So for the mobility side, the staff can, instead of having to travel in the morning, collect a device which is specific to their job role, they could work from home. They could log on from their own device. And critically, they could securely access patient apps and data.
So before mobile working, I'd have to come into a health centre, look up a child's records, I'd have to make sure I had everything I needed for the day, write everything down, go and see a child in school, come back, and then I might have to do things like follow-up calls, call school again, and actually that just takes up a lot of time. So now, with mobile working, I can check children's records on the go, I can access their information, it makes conversations with schools and teachers so much quicker, and it actually means I can see more children in a day.
The other area is that we're able to do second opinions using video conferencing. So in the past, if a therapist had a clinical query, she'd have to book another appointment with the family, get the specialist in, and then have that session. Now, we're able to, in the course of that session, have that therapist remotely join and to be able to observe the therapy session and to give advice.
It's great to have a device where you can go off-site, go to a school or a big team meeting and just have the confidence it's going to work. I open my device, I can get on everything so quickly and it looks really professional.